Hey everybody, my name is Danni Anker. I'm a nurse and I'm going to be discussing the top 3 most commonly sexually transmitted infections or STIs in the high school age population, which is age 15 through 19. These are the 3 STIs that we will be discussing: chlamydia, number 1, gonorrhea, number 2, and syphilis in the high school age population. How do you get it? How do we treat it? Tests that we can do and prevention methods. Slide shows the prevalence of chlamydia, gonorrhea, and syphilis in high school age students per the CDC in the year 2023. As you can see, out of the 3 STIs here, chlamydia is the most common STI for males in this age group, and we will be discussing this one first. We're talking about chlamydia, which is contracted through unprotected sexual intercourse with an individual. Bacteria enters a host cell, then uses those cells' nutrients to reproduce and replicate. Once it's too much within the cell, it kind of ruptures, and then the infection spreads. Signs and symptoms are listed here on the right of the page, as you can see. And some of these symptoms can be associated with other common illnesses, right? Fever, painful urination. Those could be mistaken for urinary tract infection and thus treated differently. So make sure that you're keeping an eye out of your symptoms and reporting them to your physician once you get them. Keep in mind that out of all these signs and symptoms, 75% of affected individuals are asymptomatic. So you might have chlamydia and have no symptoms. So it's very important just to keep an eye on that. Testing. Testing for this could be a PCR swab, so that's done in the office. And that's where you can self-collect it, go in through the urethra or the rectum, so anything of the drainage that's coming out of the rectal area, penile area, you can swab it in the office. You also can provide what they call a dirty sample, so you do not wipe yourself prior to giving the sample. You grab the cup, you pee in it. Typically, it's about 30 mils or less is what the lab requests to have a good test, and they're very sensitive. So if it comes back positive, you have the infection. It is not a false positive, I promise you. Treatment is typically with medication. We use doxycycline as your first choice, first line. You're going to be taking that twice a day. That's what BID means, twice a day for a week orally. And then also azithromycin can be used if you have an allergy to doxycycline. It's 1 gram, one-time dose orally. While you're on these medications or you have chlamydia, do not have intercourse while you're being treated, and also for a week after treatment to ensure the medicine has really time to work and kill this. And then all sexual partners within the last 60 days should also be treated. And then you can retest yourself within 3 months again to make sure that the infection has cleared and you do not need additional treatment. Things that you can do that do not include medication is cleaning the areas with soap and water gently, keeping them dry. Over-the-counter medications for discomfort like Tylenol and ibuprofen. Also sitz baths if there's sore areas. You basically just fill up a tub of lukewarm water and sit in there and just kind of let the water kind of clean those areas, and just make sure you dry yourself really well when you get out. Preventing chlamydia. Wear protection each time you have intercourse, every single time, including a dental dam if you're having oral sex. It's basically a condom for oral sex. Limit the amount of sexual partners that you have. For those heterosexual males, you should be tested if you're seen in the clinic for any urinary symptoms, or if you're sexually active. Homosexual males should be tested annually if sexually active. If, like I said, if test comes back positive, your other partners should be treated as well. Frequent STI testing. If you have any new partners, or even after you've got out of a relationship, make sure that you test to make sure that you're quote unquote clean. And then finally, abstaining from intercourse is like the one sure, no fire doubt that you will not get a sexually transmitted disease because you're not having sex. Gonorrhea. Gonorrhea is transferred from one individual to another from unprotected sex with an infected person. This infection grows best in warm, moist environments, so penile areas, vaginal areas, anal areas, and oral areas. It adheres to the epithelial tissues. It replicates, obtain nutrients from the environment there to grow and replicate, and then kind of gets on the highway and spreads from there. It happens in humans. And typically the symptoms show 2 to 7 days after you've been exposed. So just keep an eye out for that. kind of like with chlamydia, you have pain with urination, you have discharge, but with gonorrhea, it's purulent. Purulent means like pussy, white, yellow, green-ish, cloudy stuff. Anal discharge, same thing. Testicular swelling and or pain, usually one-sided. Painful bowel movements, soreness in the anal or penile areas, and you can have joint pain and or swelling. Testing includes a culturing of the fluid if infection is located in the joints or within an abscess. Urine tests and through urethral, rectal, vaginal swabs can be obtained as well through the NAT test, which is the most accurate. Treatment consists of IM or intramuscular Rocephin given once at the visit, but if you're allergic to Rocephin, you get a one-time dose of intramuscular gentamicin and then a dose of oral azithromycin. Non-pharmacological, meaning non-medicine treatments, consist of symptomatic care, keeping the area clean and dry using mild soap or water to clean the areas, sitz baths, which meaning soak in the tub of lukewarm water, and or Tylenol or ibuprofen for discomfort. How do we prevent it? Abstinence, obviously, is number one. Limiting the number of sexual partners you have, staying monogamous in your relationships, using protection during intercourse, condoms, dental dams, etc., and being screened annually if you're sexually active. Which occurs after having direct contact with an infected individual through oral, anal, or vaginal intercourse. The open lesion of one partner enters the other individual through mucous membranes by touch, or it adheres to the epithelial tissue, where it then gets into our bloodstream and replicates. Important symptoms may not show up for 3 weeks, up to 3 months. So be on the lookout for anything within that time period. There's several stages of syphilis, mainly primary, secondary, and latent, as you see here. Primary is where you see it. So you're seeing the sores, also known as chancres, and that's typically at the site of the entry, where it got into you. Secondary is systemic spreading, so it's traveling. You're seeing it on your palms of your hands, skin rashes. You can see it on your tummy. You can have liver lesions, mucous membranes, so oral sores. Symptoms can come and go. So be on the lookout for things that come and go, also swollen glands or lymph nodes. And lastly, the latent infection is late. This is where it's hiding. It's there, you just don't see it. And it can last an entire lifetime and can reappear later on, which is why it's important to keep a lookout for any type of symptoms that you may have that are concerning. Tests that we have, typically we could do blood tests. We're looking for elevated liver enzymes, right? Because you have those liver lesions. RPR, or the rapid plasma reagent, so testing what the virus is creating and giving off, and the FTA-ABS testing as well as the blood marker testing. If the tests come back negative, you can retest in 6 weeks if you're concerned or you've been told that you've been in contact with a partner who's been infected. You can also do PCR, which is swab testing of that open lesion to test for syphilis. Treatment is bicillin, so that's in the penicillin family. It is given intramuscular for primary and secondary infections, so the one you see, and then the ones that are traveling, systemic infections. It can also be given for late or latent infections in 2 more additional IM or intramuscular dosings. If you have an allergy to anything in the penicillin family, then it's recommended you do tetracycline, azithromycin, or doxycycline. Again, all partners should be treated, and any partners before 90 days should also be screened. So in the last 3 months, if you've had sex with someone who has had syphilis, they should be tested. Anybody over 90 days should be screened for it. And then symptomatic treatment with over-the-counter pain relievers, keeping the lesions clean and dry, moist or mild soap and water. Wash hands thoroughly after you touch any of these open areas. Don't share bedding, clothing, towels, etc., personal care items that come into contact with infected areas. And obviously, frequent testing if sexually active, and STI testing before and after sexual partners to make sure you're quote unquote clean and STI free. Abstinence, obviously, #1 method to ensure that you won't get any STIs. But lastly, please keep in mind that not everybody is aware that they have an STI, so that's why it's super important to make sure that you wear protection every single time and report any new symptoms or concerning symptoms to your medical provider right away so that you can get tested and seek treatment. It's super important at these stages in your life.